name is Britton Young, and this is my informative speech for Speech 205. So today I'm going to tell you guys about what a CRNA is. So just depending on the setting you work in and where it is, the Bureau of Labor and Statistics says that in 2016, CRNAs made between 105,000 and 242,000, averaging 157,000 a year. So basically that could buy me almost 1,600 really nice pairs of shoes. And then according to the American Association of Nurse Anesthetists, there are approximately 44,000 CRNAs in the United States, and that even includes students. Knowing how much schooling, pay, and what all you have to do can give a patient and their family insight on what a CRNA does every day. So first I want to tell you guys about what it actually takes, the schooling it actually takes to become a CRNA. You'll need a bachelor's degree in nursing or another similar field. If you're like me, you can get your associate degree, and a lot of times hospitals will pay for you to get your bachelor's as long as you agree to work for them for 2 or 3 years. You'll also need 1 to 3 years of critical care experience, and that mostly comes from a hospital's ICU or CCU, but some schools will accept ER experience in lieu of critical care. So if you get your associate's degree, you can work while you're getting your BSN, but you can also work and get your BSN while you're getting your experience to apply for school. So pretty much you kill 2 birds with 1 stone. Then you'll need to get an anesthesia degree, and that varies from 2 to 4 years depending on the program intensity. So it depends on how many credits you take in a semester or how in-depth the classes are. And according to nurse.org, there are 115 CRNA programs in the U.S. The top 5 are Virginia Commonwealth University, Baylor College of Medicine, Duke University, California State University, and Rush University. The cheapest out of the top 5 ends up being Virginia Commonwealth, and you'll end up spending $85,000 for in-state tuition. And it gets more expensive if you do out-of-state. You must pass the NBCRNA, which is the National Board of Certification and Recertification for nurse anesthetists, to become certified and be able to get a job. So if you do pass the NBCRNA, how much money will you actually make? Well, that depends on the state and city that you work in. Right now, the highest averaging state is Montana, and they average $242,000 a year. And the lowest averaging state is Arizona, and they sit at $120,000 a year. It also depends on which setting you work in. So you can work in a hospital, and you're going to get a more generic set pay. So most of the CRNAs are going to get paid the same in a hospital. And you'll end up wearing something really similar to what I'm wearing right now. You'll wear scrubs depending on the hospital, will depend on the color. And even if one hospital has a set color, some floors will have different ones. You could also work in a surgery center or an outpatient center, and that's actually the kind of field that averages making the most. So nationally they average 181,000. Or you could work in a physician's office, and they'll average more around 130, and they wear more of your business casual, kind of what your doctors dress like. So what all will you have to do if you get paid that much? You will normally work in a OR, an ER, an ICU, or a CCU if you work in a hospital. and most of the time you're working while normal surgeries would be scheduled. So 6 a.m. to 7 p.m. give or take. But that doesn't mean you'll only be working then. Sometimes they'll have to be on call for emergency surgeries or unplanned situations. So it's not unusual to see a CRNA working nights, weekends, or holidays. According to nurse.org, CRNA duties include administering precise anesthesia doses, assessing the response to anesthesia, educating patients, ensuring that the patient stays sedated, and sometimes they're expected to know how to place an arterial line, a trach, or give epidurals during labor. Overall, CRNAs have to go through a lot of schooling to get to where they need to be. The journey can be tiring, really expensive, and it can be really frustrating too. But I hope that if you do decide to become a CRNA, you're not doing it for the money, you're doing it because you want to help people, and that's just what you feel passionate about. But in the end, all the blood, sweat, and tears will be well worth it.